In this video we're going to talk about rheumatic fever, and rheumatic fever is one of the most common conditions in pediatric rheumatology, so we'll try to touch base on all the important points. So why does rheumatic fever happen? Well, it happens because essentially it's an infection with Group A Strep, and Group A Strep we can abbreviate as GAS. So that's essentially the etiology, the cause of rheumatic fever. And what happens typically is it infects, it can occur at any age really, but the most common ages are between 5 and 15 years of age. What happens is initially you get this infection, and then approximately 2 to 4 weeks later you get rheumatic fever. And rheumatic fever has some very specific and distinct signs and symptoms, but I wanted you to keep that chronology in mind, that first you get the infection and then a few weeks later you get rheumatic fever. So what are the symptoms? Well, rheumatic fever has special criteria. It's called the Jones criteria, and if you're a little creative with the way you spell Jones, it actually becomes a mnemonic for the 5 major criteria. So what are the 5 major criteria? So we'll go through them one by one. So the J stands for joints, and in particular what we're referring to is arthritis. Now, arthritis is one of the symptoms that occurs in rheumatic fever, and it can occur in several joints, but the most common ones are ankles, knees, elbows, and wrists. And it's a very painful arthritis, and it can be very swollen and tender, red and hot. The next major criteria, now the O is the second letter in Jones, of course, but in our mnemonic we creatively shaped the O into a heart, and there's a reason for that. That's because the heart refers to carditis, and carditis, as the name implies, of course, is inflammation of the heart and the heart muscle. And what's important about this is that of all the major criteria, this is the one that can lead to a chronic manifestation, a chronic damage or disease. And in particular, what we're talking about is valvular dysfunction. And the most common valve that's affected is the mitral valve. So mitral valve damage. All the other major criteria are transient or temporary, that resolve when you treat the rheumatic fever, but this is the one that can lead to a chronic problem. The N stands for nodules, and in particular what we're referring to is these cutaneous and subcutaneous nodules. Subcutaneous nodules that can appear on the body. The E is referring to a specific rash known as erythema marginatum, and this is a slightly raised red painless rash that can occur. And the final major criteria is S for Sydenham's chorea. And Sydenham is somebody's name, I think. And chorea, as you know, is a neurologic movement disorder. And in particular, with rheumatic fever, what you're talking about is a rapid and irregular jerking movements that can happen. So if you have major criteria, then you must have minor criteria. So what are the minor criteria? Well, there's only 4. One of them is fever. Well, obviously, rheumatic fever, you'd think fever would be somewhere in there. The next one is arthralgia. The next minor criteria is elevated ESR, erythrocyte sedimentation rate, or elevated C-reactive protein, CRP. What these are lab tests that are elevated in states of inflammation. They're non-specific indicators of inflammation. And the final one, final minor criteria, is a prolonged PR interval on the EKG. So why break this up into minor and major? What's the deal here? Well, to diagnose rheumatic fever, you need to have 2 major. If you have 2 major, then you've got a diagnosis. Or 1 major plus 2 minor criteria. Yeah. And of course, you have to have that Group A strep infection as a, as the etiology. So now we listed all this criteria. I just want to list the diagnostic tests. Now, of course, other than the physical exam and the signs and symptoms, what type of tests would you do? Well, the first one, of course, is to test for the organism, which is Group A strep. And this can be tested in many ways. You can do a culture. You can also do these titers, anti-streptolysin titers. There's a few ways of testing for Group A strep. The other test that you do is an EKG, and that's part of the minor criteria I talked about. And then, of course, the non-specific indicators of inflammation, either erythrocyte sedimentation rate or C-reactive protein. And these are simple lab tests. Okay, so now we get to finally the treatment. How do you treat it? The treatment involves 3 major things. The first thing is you're treating the infection itself. Treating the infection, in particular the organism, is Group A strep, and that is done with penicillin. The second component to treatment is treating the pain and the fever, and that is done with any salicylate like aspirin. You can also use any NSAID, non-steroidal anti-inflammatory drug. And then the final component is prophylaxis. And what I mean by that is a person who has Group A strep infection, rheumatic fever, can get it later on in life. So you need to give them prophylaxis to prevent a recurrent Group A strep infection, and that is done also with penicillin. And if a person is allergic to penicillin, then you give erythromycin. Okay. Finally, I wanted to finish off with 2 clinical vignettes, and here we go. A 38-year-old patient informs her physician that in her childhood she experienced 2 bouts of rheumatic fever. Although she appears to be well at present, which of the following sequelae of rheumatic fever is most likely to present as a chronic disease in her later years? If you remember the Jones criteria, in particular the major criteria, there was one in particular that leads to a chronic problem, and it had a heart in front of it, and that was carditis. And carditis later leads to valve dysfunction, and in particular the most common valve that's affected is the mitral valve. So mitral valve disease is the answer to this one. And then finally, an 18-year-old boy presents with a temperature of 38.4, low back, wrist, and knee pain. He had a sore throat 1 month earlier. His arthritis is diffuse. Pea-sized swellings are noted over the skin on his knees. He has a serpiginous erythematous area on his anterior trunk. His blood and throat cultures are negative, and CBC is unremarkable. His anti-streptolysin O titer is high. which of the following is most appropriate therapy? Well, this is a good question. It kind of touches on a lot of things. Well, he's got a fever. This low back, wrist, and knee pain is talking about arthritis. This sore throat 1 month earlier is talking about the Group A Strep infection that he had 4 weeks ago. A pea-sized swelling are noted over the skin on his knees. I think that probably is referring to those nodules that we talked about, subcutaneous nodules. Erythematous area on anterior trunk perhaps is referring to that erythema marginatum, which is part of the major criteria. And then finally, they do say that is one of the tests for strep is positive. So obviously this patient has enough criteria to diagnose him as having rheumatic fever. He's got 2 major, he's got 1 minor, and all that stuff applies. So they're really asking for is the treatment. And if you remember the 3 components of treatment, the first is to treat the infection with Group A strep with penicillin. And the third is to treat the pain and the fever with any salicylate like aspirin or any other NSAID. And then finally there's prophylaxis involved, which is also with penicillin. So it looks like D covers those components.